I've struggled with this my whole life. It just made me so insecure and life-changing. Thank you, Dr.
LEBO Gyno and Beyond, always Beyond. Got this 21-year-old young man from Montreal, Canada, who in middle school, believe it or not, middle school about 8 years ago, so he was, in his teens, like in early teens, they did gynecomastia surgery on him. Ridiculous. I don't know what the Canadian doctors do. They excised, big excision here, and I don't know what they did with his nipple. This is like, they took it off and put it back on. But look at the difference between this nipple and this nipple. This nipple is semi all right. This nipple is high and out. We're not going to take off the nipple. I'm not going to do that. I'm not going to ruin the nipple. I'm not going to take this off and put it here because then I got to deal with the hole. The scar is acceptable. He's got some dog ears, I call them, mainly right there. And a little bit right there. I'm going to smoothen that out a little bit. But look at the concavity here. Lift up both arms, my man. Look at the shark bite, the concavity. Now put your arms down. Again, look at that shark bite and worse shark bite there. Again, I'm not going to remove the nipple and place it somewhere else. That would be a horrible thing to do, at least right now. Our plans are to do VASER Hi-Definition LipoSculpture, VASER to break up the scar tissue and to melt the fat, micro-air High-Definition LipoSculpture to harvest fat, give him a six-pack, 2, 4, and 6, the midline linea alba, the semilunaris, get down below his belly button, get all this stuff kind of broken up and released. Same thing here, smoothen this out, harvest fat. Get to his back, because I have to harvest at least 600 cc's of purified fat, and we're going to do fat grafting through stealth incisions, fat grafting under the muscle to recreate the beautiful pec muscle. Do excision of the dog ear, and again, right now, I'm not going to do anything with the nipple, just leave it, because if I move this here, then I got to deal with the scar here. And we can do that some other time, but let's keep it simpler. As I take this off and put it on, I don't know about the blood supply to these nipples. I don't want to cause him a problem. Stealth incisions ×5 in the armpit. Usually I do it at the 6 o'clock position of the nipple. Here I'm going to do it in the scar here to create lines and shadows and get the fat, do the six-pack abdomen and harvest the fat to do pectoral lipofilling to recreate volume on his chest. It's going to be done beautifully, comfortable, and safely and dynamically under local anesthesia. So if you have gynecomastia, hopefully you don't go to somebody who will botch you and then come to me to repair this and to fix it and to unbotch you, like this young man from Montreal, Canada. But here he is, here I am, and I'm going to fix him up and make him look fantastic. So LEBO Gyno and Beyond, fixing botched today, 631-424-0101, or email me at jonathanlebowitzmd@gmail.com. Let's fix them.
I want to pump you up.
Alright guys, so what we're doing is I'm vasering underneath the scar tissue now of his chest. I put this cord not by the nipple because the nipples are too high, and I'm not going to lower them. I'm going to lower the fold of it. Checking out the anatomy here. scar. So we're going to 3. You okay? Good. And just breathe gently. Alright guys, so now we VASER the scar tissue and the fat of his chest and his belly. Now we're using micro air. This is a power lipo. You see other ones, doctors, they do this, it's rough, and they go, you know, let the machine actually etch this out beautifully. So I'm smoothing this out from the previous surgery. And we're gonna etch this beautifully. So I'm harvesting fat from areas where I don't want it, leaving fat like over here where I want it, by the lats, and I'm going to add fat to the area of deficit, which will be his pecs. Yep, we're digging here. Almost. Get that cleavage here. Down at the nipple incision, but I'm not at the nipple incision. I'm at the old scar, hide it in there, and I'm going down, all the way down south. For 2 reasons, to sculpt them and to harvest fat. And all the way to his hips. Alright, so now I'm sucking your belly there. Sucking your belly. Sucking your belly there. So, getting this midline, guys. Suck it in. This is very important for the aesthetics. Suck it in. There you go. Look at that. And I gotta do this and the horizontals as well. Suck in your belly. There you go. That's beautiful. Am I up to 15 almost? Almost. Alright, so now we're You're doing well. Now I'm etching the horizontal of the six pack. Goes down. So I'm doing the Cobra Kai. Cobra Kai. So this is Renuvion. Renuvion J plasma. This is helium gas with a radio frequency spark. And this is FDA approved for skin tightening after lipo. I want them tight as a drum. I'm going to do Renuvion in the chest and the belly. Okay? Under this old scar tissue and really tighten it up. What that? Not right now. I'm working on it. Alright, so now I gotta get punctured under the muscle. There I am. I can tell exactly where I am. Dr. LEBO Gyno and Beyond, amazing results. This young man, he's 21, he's from Montreal, Canada, where in middle school, about 8 years ago, he's 21, so 8 years ago, he had gyno surgery in Canada, in Montreal, and they just cut out his skin, did a nipple graft, and he just was indented with a big shark bite. So he lived with this, and he said he's had enough. He contacted me here in New York, Long Island, and he's here. We finished up this beautiful case, Fixing Botched, where we did VASER Hi-Definition LipoSculpture LipoSculpture, Renuvion J plasma to tighten everything up, and pectoral lipo filling. We got out about 3 liters of fat, and we put in a liter of fat into each pec, probably about 300 cc's in each pectoralis major muscle, in and under the muscle, to recreate the aesthetic, the dynamic, the Hercules, the gladiator appearance of his chest. We didn't have any fat left to do the deltoids or the lats, which is fine. This is what we came for, and this is what we accomplished. Stealth incisions ×5, armpit. Below the nipple, in the old scar from the mastectomy, we left the nipple alone, and inside the belly button, where we created definition. We etched, defined, and revealed the pecs, the delts, the lats, the serratus muscle, the six-pack abdomen, sucking your belly, 2, 4, and 6, the midline linea alba, the semilunaris, all the way down to around his belly button. The belly button incision is left open to drainage, and we did closed drains in the armpit to make sure that he has no fluid that would distract from this amazing result. Now look at this fine look of this pec muscle. Make a muscle. That great look, and it's in the muscle, not on top, in the muscle where there's plenty of vascularity and where it survives. Look at this side right here. Make a muscle again. Look at that great shape there. This little squiggly thing, that's the drain, of course, that comes in. Look at the shadows and the lines that I created. Make a muscle again with your pecs. The male cleavage. This is perfection, and this is what my patients expect and what they deserve. So if you have gynecomastia, either primary or, like this young man, secondary from a botched result, wherever you are, in Canada, in Columbus, Ohio, in, I don't know, wherever you are, people come to me from all over the world for my spectacular gynecomastia and beyond results. You call me Dr. LEBO Gyno and Beyond, 631-424-0101, or email me at jonathanlebowitzmd@gmail.com. Let's go.